Okay, so I am basically practicing doctor in Meenakshi Medical College, Chennai. I'm too much into the fitness field and I want to get into, kind of like towards a healthy lifestyle. So genuinely was interested into getting into nutrition and knowing better. So right now, all my clients, everyone is very active on Instagram, and NFNA had a sponsored advertisement on Instagram, so that's how I came to know. There was a free sort of like a survey questionnaire or something, so I filled that up, and yeah, I got a call from there. This was the clinical nutrition course. I'm looking forward to doing the diploma as well, but I have some commitments over here right now, and I have like my final 2 sessions for surgery, and also might not be able to continue right now, but like for sure in the future, I'll be continuing my diploma. In terms of knowledge, I have read a lot of things about Alan Sir because like I've read the articles and all. A few things that he has taught me and the way he has shown me how to approach things, I've started to do that in real life as well. So in terms of knowledge, I am nobody to judge him on his knowledge, but he's an impeccable person. He knows what he's teaching. He's not just going gung-ho about whatever he's talking about on screen. And about like I am a huge fan of his physique as well because he's not just a nutritionist, he's also like so much into his workouts, and also I've been constantly following him and NFNA on social media as well. So I know what everyone is doing, but like his knowledge wise, the way he reads research papers, the way he approaches every minor thing in the nutrition industry, the way he is keeping a tab on all the other nutritionists in his area as well. I know he's really nice, he's really knowledgeable. So it was insane because one of these things, like I have seen a lot of professors even in my medical college, and even they are not this patient. Okay, Alan sir not once like he was irritated by the questions or anything. He just like took his time, made everyone comfortable, and then he explained everything. So it was so nice, and the notes that he has given, absolutely amazing. Like even right now, the concepts are, like absolutely clear, crystal clear. The thing is, sometimes I just want to revisit the notes, and yeah, I have it, like it's easily accessible on the app, so that's good. Pretty much, because not one thing that I've been taught over here has been like, okay, I'm giving you this piece of information, you have to memorize this. Not once, not one faculty member has said that. Everyone, whoever has taken the lecture has told me, if you don't agree with this, please go verify, read a research paper about it, and then go about what your thought process is. As of now, to be very honest, I have not really started working, and but also we had a social media managing class, I think that is what it is called, and the sir who took it, the sir basically gave us an idea as to how we have to manage a business, because having knowledge about nutrition is one thing, and having to make it into a business is one completely another different thing. So he gave us a brief idea about how that has to be done, and that was really helpful because a lot of things like the advertisement about it, how to go about the diet charts, how to make it a bit more kind of attractive for the clients as well, how to talk to them, everything related to that was explained really nicely. So I mean, I will put that to use in the future, but right now I'm not practicing. Actually, the course, the day it started, I was on a vacation, and I didn't have the idea that it's gonna be clashing with my vacation dates. But I took out some time in the evening, and I told my friends to wait for me. I was in the hotel and logged in. And the first class, I think, was just the orientation class and like introduction for everyone. So I was kind of skeptical as to why we have to do this, because why we need to get introduced to everyone. Why do I need to listen to the introduction of all the people of my class? there was around like let's say 15 to 20 people. But sir told one thing, ki these are not just your batchmates or your classmates. These are also gonna be I mean, these people are also in the field right now. Okay, so these people will help you to get client. These people will become your family eventually, because there are some things that I might not be knowing and the other person might be knowing. So the whole thing becomes a huge family. And to be very honest, I got into touch with around 3 to 4 people from my batch, because one I heard was a gym instructor, one I heard was into boxing, one I heard was a MSc nutritionist. So I had to get into touch with everyone to like pick the brains and understand how everyone's functioning. So that actually helped me socialize, get to know, increase my network. So that's the best thing that I liked about the class, because like it just helped us to mingle with everyone and keep it professional as well. WhatsApp support is phenomenal. I mean, there's hardly any time that I have to wait for a reply or anything, because like anytime I text, even like Alan, so hardly I have to wait 5 minutes and then I'll get a response. That's all. As far as the teaching method is concerned, I mean, yeah, from the basics to the complicated aspects of it, everything was so damn simplified that I didn't face trouble at all in like understanding any concept. So the teaching methodology was really good. I mean, I liked it very much. Definitely. I mean, even for now, as far as my diet is concerned, I was 84 kgs when I took the class. After the classes, when I came to know actually how much fat I should be consuming and how much protein I should be consuming, I have lost around 7 kgs. So that is pretty good for me. And I know what a healthy lifestyle is right now. I know what the importance of micronutrients are. So I am starting to do that in my own diet first, to see what kind of difference I'm noticing with my normal sleep pattern, my normal eating habits, metabolism, everything. And then I'm trying to inculcate these habits into my family members. So it is pretty much easy for me to accept whatever that I've been taught. The second or the third class, when we got to know about how to prepare the diet charts, I started doing this, and I was pretty comfortable with it, because as such I was so much into nutrition that I had a brief idea about how to make this and stuff. But then when Alan sir gave us like the correct path as to how to approach a diet chart, I learned it, I picked it up pretty well, and yeah, I also submitted one of mine to Alan sir, so he was pretty happy with it. Yeah, and I'm doing it. It's really easy. I mean, it's not that complicated, mainly because of the teaching. I think like sir was really nice and considerate with his teaching, so I'm easily able to do it. In a BSc course, we'll also be focusing on as to the minor biochemical concepts of it, and we don't really need that when it comes to preparing diet charts. We don't need to know what the chemical structure of a carbohydrate or an amino acid is. We just need to tell the client as to what is the requirement, how much protein goals you should hit, or what is your weight requirement, whatever. Okay. So in terms of like having a clear cut, client based approach, this course is much more useful than a BSc course, I would suggest, because in a BSc course, I don't think nobody would have taught me how to make my knowledge into a business and how to approach social media as my business platform. So this was much more crisp, precise, and easy to target my future clients. For the future, so basically why I took this course was, as a doctor, we can recommend medicines to treat the patient, but there is something that we can do to prevent it. So basically having a healthy lifestyle, having a healthy diet can help me get a better lifestyle for the patient as well. So this knowledge of clinical nutrition that I've received from here, I'm planning to put it to use to help the patients have a better lifestyle after the medications or before the medications. So might as well start practicing as a normal nutritionist or dietitian. But for now, it's just for the patients and the close relatives. I have obviously recommended this not just one of my aunties. I told you she was my batchmate, so I recommended this course to her before I got into it. So that was my recommendation because I've heard about NFNA from my friends as well. So this was pretty good experience for them. And in the future as well, because I have a lot of people into this fitness industry, so I know a lot of people who would want to learn nutrition on a deeper level and do a diploma course into it. So for sure I'll be recommending this to them.